Happy to be here this morning, and I'm so proud and I'm so happy to see so many men here this morning. Give yourself an applause. Now, I'm going to share a whole lot of information with you this morning, and I'm going to tell you stuff that probably you've just taken for granted and never really thought about it. And I'm going to try to cover most all of your questions in the presentation, but if you do have any questions, I'll be happy to answer them, okay? So we're going to start out by looking at the eye and explaining to you exactly what happens. Now you see on this picture, you can see the eyelids, and I'm going to explain to you because you probably don't even think about what happens when you blink. But you have a lacrimal gland up here. The lacrimal gland, if you can think of a windshield, when you press your windshield washer to squirt water to clear your windshield, when stuff gets on your windshield, the windshield wipers come and washes it off. Well, the lacrimal gland right here is constantly producing tears on the surface of your eyeball, okay? Have little openings here at the base of your lashes where the tears are squirted onto the eyeball. And as you blink, the eyelid is actually like a little windshield wiper. If we were to take a picture of you, a video of you blinking, you would see that your eyelids actually come down and in. And what happens, as tears are squirted onto your eyeball, the eyelids come down, they wash the tears over into the lower punctum and the upper punctum. And these are the ducts that drain the tears out of your eyes. And why is that important? That's important because you have all kind of little molecules in the air that you can't even see that are constantly getting in your eyes. So it's a self-cleansing mechanism for the eye. The lacrimal gland produces tear on the surface of the eyeball. As you blink, the lids wash all these little molecules that get in your eye down your nasal lacrimal duct system. These ducts in your eyelid that drains down into the lacrimal sac that runs all the way back and drains down into your throat. And that's why you're constantly swallowing saliva or spit all the time, because of all the drainage that occurred from your eyes, your ears, and your nose. Okay? So it's a self-cleansing mechanism where a lacrimal gland produces tears. As you blink, you wash all these little tiny molecules that you don't even think about getting in your eyes. But it's the air is full of all kind of little molecules that constantly get in your eyes. And this is a self-cleansing mechanism that occurs. Now, this is a cross-section of the eye. If we would take the eye and cut it in half, this is what it would look like, okay? You got the pupil, the cornea, which is basically a window that has some refractive properties as well, and the lens. Now, we're in a room where we have a source of light. If we were to put you in a completely dark room with no light source, you couldn't see anything because you must have light rays in order to focus the image on the retina, okay? These are infrared rays that you can't even see, that you don't even think about. But you're looking at me now, you see me because of the light source. My coat, my face, everything is absorbing this light energy, and these light rays are being reflected. These light rays come through your pupil, through the cornea, through the pupil, and you have a lens here. This lens inside your eye focuses just like a zoom lens on a camera. You're looking at me now. There's a little tiny image of me on your retina in the back of your eye, okay? This is an oversimplification as to how you see. So what happens is the lens focuses these light rays, actually a little picture on the retina, okay? The retina has photoreceptor cells that convert this light energy into an electrical impulse that's carried by anywhere from 1.25 to 1.50 million little tiny neurons in the back of your eye in the retina. These neurons all come together to form the optic nerve. So this information that's being gathered by the retina in the back of your eye is transferred to the optic nerve, which runs all the way from the back of your eye, all the way back to your occipital lobe in your brain, in the back of your head. That's how you know the difference between the color red and green. The information is collected by the eye, and I think of the eye as really being an extension of the brain. It collects information, feeds it to the brain where it's interpreted, okay? It's so amazing, and this is how I was attracted to ophthalmology ever since I was 5 years old. My father worked for an ophthalmologist, and I always wanted to be an ophthalmologist like he was. Okay, very important here now. This, I'm showing you the muscles of the eye as to how your eyes work. You do this all the time without even thinking about it, but you really don't understand what's going on or what's happening. And we're going to help you with that today. You have little muscles that are attached to your eyeball. Like when you look to the right and you look to the left, you look up and down, the brain has to send a message to the nerves that innervate these little muscles that allow you to look to the left, to the right, and up and down. You don't even think about it. But if you look across the room and then you look close up, there's an impulse that comes from your brain to these little tiny nerves that innervate these muscles that focus your eyes. And it's so fast and it's so miraculous as to the way that it occurs. You look off at a distance, you look up, that information has to come from your brain to these nerves that innervate the muscles that allows you to focus off at a distance and close up. And I think I read somewhere it says like it's about maybe 20,000 miles per hour the way this, as fast as this occurs without you even thinking about it. So here we see that we got muscles that move the eye up and down to the left and to the right. The innervation is LR6SO4. The lateral rectus is innervated by the sixth nerve, superior oblique by the fourth, and all the other muscles by the third cranial nerve. So don't worry about that. But this is an example as to what happens. Okay? This is a picture of a cataract. You can kind of see the opacification of the lens, and a cataract is an opacification or a clouding up of the natural lens in your eye. Now, remember what I told you. This lens is responsible for focusing the image on the retina that allows you to see. Well, if the lens is cloudy, the light rays can't pass through it to form a clear image on the retina. Thus, it's like looking through a frosted window versus a clear window. Cataract is a clouding up of the natural lens, and it's a natural aging process. If we all live long enough, we'll all develop cataracts eventually. Okay, so a cataract is a clouding up or an opacification of the natural lens in your eye. Now, this is one of my favorite subjects because I am a glaucoma specialist. I did 3 fellowships in glaucoma. I actually trained with the father of glaucoma at Harvard, Dr. Morton Grant, who wrote the first book in glaucoma, who's basically responsible for me being a glaucoma specialist as well. I also trained with the people that wrote the second book in glaucoma, Becker and Schaefer, out at Washington University in St. Louis. So back in the day, we used to think of glaucoma as just being increased intraocular pressure, where the pressure builds up in the eye so high that it cuts off the circulation supplying the optic nerve, thus leading to blindness. But we start seeing people who had low pressure that still had optic nerve damage. Thus, we thought, oh, something else is going on here. So the term low tension glaucoma was recognized. People can have low tension, but vascular insufficiencies as far as supplying the blood to the optic nerve, and they can still end up with nerve damage. Thus, we've changed our thinking of glaucoma as merely being increased intraocular pressure. Now we think of it as it being somewhat of an optic neuropathy, where you can have increased intraocular pressure in your eye to cause damage to the nerve, but you can also have vascular insufficiency, which means you're not getting enough blood supply to the nerve that can also cause nerve damage as well. Those are the two, but the main risk factor is an increased intraocular pressure. Now, if you go to the doctor and he tells you you got glaucoma, all right, your next question should be, well, doctor, what type of glaucoma do I have? Okay, because what I see in my practice, and my practice is mostly a tertiary ophthalmology practice where most of my folks are real sick people with glaucoma, diabetes, and a whole lot of other stuff, okay? So if you say, well, you got glaucoma, your next question would be, for what type of glaucoma I have, because there are different types of treatment for different types of glaucoma. And I see this all the time, where basically most of the people get shotgun therapy. You got glaucoma, boom, here's a drop, you take it, without identifying the specific type of glaucoma and structuring a specific type of treatment. Now, I'm a sniper. I'm gonna hit the bullseye. I don't believe in shotgun therapy. So what I do is patients come in, I try to identify the type of glaucoma and structure a specific type of treatment for that specific type of glaucoma. Very important, because a lot of folks go blind unnecessarily, especially Black folks. The incidence of glaucoma is 20 to 25% more common in the Black population and in the Hispanic population and Asian population versus Caucasian population, okay? It's basically a genetic, we've actually isolated the gene that causes glaucoma, all right? So the cutting edge of medicine right now is, okay, we isolate the genes that cause the disease, we figure out how to block that gene, thus prevent the disease from occurring, not just with glaucoma, but with other areas in medicine as well, okay? So glaucoma is non-forgiving. Once you get the nerve damage, it's permanent and irreversible. So if you are Black, if you are 30 or older, if you have a family history of glaucoma, then you need to see somebody who knows what's going on, okay? A lot of our folks go blind unnecessarily because they don't get to the right people at the right time. And glaucoma is non-forgiving. Remember, if you're Black, you got a family history, you're 30 or older, you need to see somebody who knows what's going on, because the disease is a slow, insidious process. You don't lose vision like that. It gradually, slowly creeps up on you. Now, you can lose up to 95 to 98% of your nerve function and still have 20/20 vision, but it's a tiny pinhole vision. And this is the trap that I see so many people fall into. Well, I can still see. My doctor said I'm seeing 20/20, but you're only seeing 20/20 with 1 to 2% of your nerve left, okay? And then it's getting ready to go out on you. So the key is being proactive rather than reactive as far as diabetes is concerned and glaucoma. You gotta be proactive because the disease is non-forgiving. Once you get that nerve damage, it's permanent and irreversible, okay? So if you're at risk, you need to be seen by somebody who knows what's going on. I get far too many people who come to see me, 1, 2% of their vision left. 98% of it's gone. So I'm trying to keep them from going completely blind. That's very difficult to do. Very difficult to do. But my objective is to, with my patients, and I tell them this, my objective is to try to keep you seeing the rest of your life. After that, it won't matter. Okay? But you have your eyes are your independence. You have to be able to see, all right? I'll tell you a quick story. I had a lady who was a multimillionaire. She didn't come in to take care of herself. She gradually lost her sight, went blind. And family members, everybody who knew her, stole all her money. She ended up completely broke and actually on the street and was dead in 6 months. So your eyes are your independence. Maintain good eye health. If you're at risk for any of these things, be seen by somebody who knows what's going on, okay? Now, another thing people will come in and ask about is stigmatism. Well, let me just put this in a simpler format so you can understand. Your cornea that we talked about, as you can see on this picture right here, okay? Now the cornea, if the curvature of the cornea in a vertical direction, up and down, is not equal to its curvature in a horizontal direction, that creates an irregular surface on the cornea. So as light rays are passing through the cornea, the light rays that strike an irregular surface are going to be bent. It's hard for the lens to focus bent light rays on the retina to create a clear image versus light rays that pass straight through undeviated. So astigmatism creates an irregular surface on the cornea. So when these light rays are passing through, they are bent and reflected versus being passing straight through, parallel, undeviated. So straight light rays are easier to focus on the retina rather than bent light rays. Thus, the bent light rays creates a blurred image. That's basically what astigmatism is. A lot of folks ask about it, but that's basically what it is. Now, this is very important here. People come in and they say, I have a sty, okay? Now, that's the common term, but more specifically, a sty or a chalazion or hordeolum is an installation of the meibomian gland. Remember I told you you have secretory glands in your eyelid to produce secretion, all of us have a clear layer of oil on the surface of our eyeball that lubricates our eyelids every time we blink. Otherwise, it would feel like sandpaper when you blink, okay? So those glands along the lid margin here, you got them here at the base of your lashes, those glands are constantly producing and secreting a clear layer of oil on the surface of your eyeball that lubricates your eyelid every time you blink. Well, now, anytime you got secretory glands that produce secretions to lubricate an organ surrounded by hair follicles, you gotta wash them to keep them clean. Most people don't scrub their eyelids, thus the glands get plugged up, okay? So now, when you go to the doctor and you say, I got a sty, okay? To differentiate between a chalazion and a hordeolum is very important. Why? Because this area right here, if you drew a triangle from here down to here and around here, okay? The venous circulation in and around the eye right here drains directly into the cavernous sinus in the brain. So you got to be real careful whether you're dealing with a non-granulomatous inflammatory response, which is what a chalazion is, or what folks call a sty, versus a hordeolum. Now, a hordeolum is a gland that's infected, an abscess. So if you got infection in this area, in here, you don't want to stick a needle, you don't want to stick a pin in here, you don't want to squeeze this thing. Because if you do, you can force bacteria into your venous circulation that can drain into your brain, and you're in serious trouble. So if you got a sty and you go to the doctor and you say, well, you say I got a sty, well, is it a hordeolum or is it a chalazion? Big difference. Now you see this patient, and it's hard to diagnose in Black folks or dark pigmented people. But if you look at this picture, you can see the lid is inflamed and it's red, okay? So thus, the gland is infected. So the infection is marching along the lid margin, and you got a lid cellulitis here. So that means that you need to be treated with oral antibiotics to keep the infection from spreading, okay? It's because you can have, again, circulation gets into the venous circulation, can drain into the brain, all right? So you want to know, well, is this a hordeolum, which means the glands is infected, or a chalazion? So you can treat a person with antibiotics. Most of the time it will clear up. Warm compresses, you see it's trying to come to a head and trying to drain on its own right here anyway, right? So the antibiotics would help. If not, you can lance it and drain it and get rid of it. So if you have a sty, you go to the doctor, you say, okay, you say I got a sty. Is it a hordeolum or is it a chalazion? Ask that question because it's going to determine how you should be treated. And it can be very devastating, okay? Now, another big subject here, diabetes. Now, diabetes is a small vessel disease. The increased sugar in your bloodstream actually destroys the inner lining in the blood vessels, specifically the pericytes, which lines the inside of your blood vessels. The sugar kind of eats away at those cells. It puts holes in them, fenestrations, all right? Now, if you can think of battery acid on your battery, and probably all of y'all have done this, I certainly have. You look, you got to build up a battery acid, you pour a Coke on it, you know, it all fuzzes up and dissolves, okay? This is an over dramatization as to what this sugar is doing to the inside of your little tiny blood vessels. It's eating away at those cells, okay? When you get openings in the cells, the first molecules to leak out is plasma because the molecules are smaller than the RBCs, the red blood cells. So with diabetes, the inner line is a small vessel disease, and where we have little tiny vessels at, in the back of our eyes, our brain, our kidneys, our heart, and supplying the little tiny vessels in your feet and legs, okay? So if you're diabetic, you always gotta be concerned about your brain, your heart, your kidneys, and your feet and legs. A lot of diabetics have heart attacks, strokes, they end up with kidney failure on dialysis, and they lose a foot or a leg. So I've always said that I don't want anything to do with Alzheimer's, cancer, or diabetes. Having taken care of diabetics for the last 40 years or so, I have a tremendous amount of respect for diabetes. It is a very devastating disease. It can destroy every organ system in your body. So if you are diabetic, you have to keep your sugar under good, tight control, your A1C under good, tight control, and your weight, because it predisposes you to so many disease processes that can affect your brain, your heart, your kidneys, and everything else throughout your body, okay? Very serious here, and it's so prevalent among our Black folks because of the diet that we have. It is hard for us to find good, healthy food in our communities. We're overloaded with fast food joints where you can't get good, healthy food. The reason being because we don't demand more. We support these places that are just feeding us food that's killing us. We have to demand, we want better food. We want better menus in the restaurant so we can eat healthy, okay? Now you see here, this is a picture of like the first stages that you see in diabetic retinopathy. This is macular edema from, remember I said the plasma, the clear fluid in your blood, smaller molecules, they leak out first. Now, we've all heard folks talk about macular edema, macular degeneration on the TV. You turn the TV on, all you see is folks advertising medications for this, that, and everything else. They just bombard us to death. But anyway, if you're diabetic, your medical doctors, when you're first diagnosed with diabetes, they should say, you need to go get a baseline eye examination. Okay, so we can see if you're developing macular edema in the first stage here. Now, what is macular edema? Macular edema is edema in the macular portion of your retina. What does the macula do? Put your hand over one of your eyes. Okay, now, if you look straight ahead, that's macular function. So if you're looking at me, macular function is that central 30 degrees of vision. Now, if this patient covers the other eye and looks straight ahead, if she's in front of me, she won't be able to see my face because that's macular function. Only peripheral retina function is intact. So your central vision is gone, which means if you develop this, you can't drive because you can't see straight ahead. Just your peripheral vision is intact, okay? So that's why it's imperative that when you're first diagnosed with diabetes, you come in and get a good baseline exam. Now, that means that there are certain diagnostic tests that need to be ran on you. It doesn't mean that you go and you have your vision checked and you be given glasses and you're sent on your way. No, 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 no. That's why so many Black folks go blind unnecessarily. You need to have this done, a dilated fundus exam with photographs like what you see here, but more importantly, you need to have OCT done. Ocular coherence tomography. That was a system that a colleague of mine developed when I was training at Harvard in conjunction with the MIT engineers over at MIT, where we developed this system where we can scan the back of the eye to determine macular edema, how thick it is, so we can track it to see if the treatment is getting better or not, okay? So those are tests you need to have done. Don't just go somewhere and they give you a pair of glasses and send you on your way. You need to have diagnostic tests done and documented so you can track your progress, see where you are and what needs to be done. First stage. Now, you see here, this is a vitreous hemorrhage. This is what happens if you're left untreated. Remember I said diabetes is a small vessel disease. It leaks plasma first, but when you see this is blood leaking out through the little tiny vessels in the back of your eye, okay? So this is a bad, bad thing. When you get to this point, you're kind of in a grave situation. Being that when you bleed in the back of your eye, it causes scarring, which pulls the retina up, causes retinal detachments, and all sorts of problems. It's a bad prognosis. So therefore, now here again, you can't feel any of this going on in the back of your eye. So you want to catch it way before it gets to this point. You want to be proactive. So when you look back there and I see little tiny hemorrhages where folks are starting to bleed, you want to treat them right away. You don't want them to get to this point. But the danger is that you can't see or you can't feel it. You don't know you're bleeding in the back of the eye till you get to this and this. And then you're in big serious trouble. Okay? Here again, see somebody who knows what the hell is going on. Okay? And get yourself checked out. Follow up with your visits like you're supposed to. It's pretty much non-forgiving. When you get in trouble, you're in serious trouble, which means that you got to go in the back of your eye, try to clean up all of this blood. And when you get to this point, you got a whole lot of scarring that's pulling the retina up. And you see this is the macula here, but look, you got hemorrhage all in the macula area right here. So you can't fool around in the macula as far as removing this blood or shooting it with a laser, because once the macula is destroyed, it's destroyed. Your central vision is gone. So the key is being proactive to prevent you from getting to this point. And over here, this is real bad. This is old blood. This is fresh blood, but it's been back here a long time. And you see how dark it is? So that's a bad situation. So, and the thing that's so heartbreaking to me, and it hurts me to my heart, is that I'm only one person. I can't see everybody in Atlanta, everybody throughout the world, even though I get patients from all over the world. But for someone to get to this point and end up blind, it's heartbreaking, because it does not have to happen if you get to the right people at the right time. Y'all understand me? Yes, sir. This would be a diabetic exam, and people will do that. Okay. Here's another thing: high blood pressure. Now, Dr. Flowers can tell you, if you got diabetes, high blood pressure, high cholesterol, that constitutes the metabolic syndrome, which means it increases your risk factors as far as having strokes, heart attacks, losing your kidney function, ending up on dialysis, and losing a foot or a leg, and losing your sight. So if you got those three things, you're at very, very high risk. Now, another thing is diabetes, high blood pressure, high cholesterol, but also being overweight, okay? Obesity is one of our main risk factors that we have that's killing us like crazy as well. You need to try to get down to your 25 percentile BMI. You get down your 25 percentile BMI as far as your health is concerned, and as far as diabetes is concerned, pretty much you can cure yourself of diabetes a lot easier than you can for high blood pressure. Once you get started on high blood pressure medication, it's hell to stop. You can't hardly stop it, okay? But if you control your weight, keep your sugar under good tight control, get that A1C down, you can do a whole lot better with with your diabetes, high blood pressure, and all this other stuff. Now you see high blood pressure, glaucoma, diabetic retinopathy, macular degeneration. We've already talked about that. High cholesterol. Now back in the day, we used to think of, oh, you see it, you look at the cornea, you see a gray ring around the cornea. You think, oh, the patient has increased high cholesterol. But we did a study at Harvard that showed that that didn't pan out to be exactly true. So if you see it in a younger person, you get concerned, but older people, a lot of older people will develop what we call arcus senalis, which is an infiltration of cholesterol into the cornea, but it's not directly related to an increased cholesterol level. All right, another thing that I get asked about all the time is patients come in and they want to know, can you give me a prescription for marijuana to treat my glaucoma? Okay. Now, when I was training at Harvard, one of my classmates, Claudia Eric, actually, we did a study where we actually isolated the THC out of the marijuana, put it in a drop form, and did clinical trials to see if it was effective as far as treating glaucoma. And it did not prove to be effective. Okay, so that's kind of like a fairy tale for folks that want to get high, but it's not a treatment for glaucoma. All right, so I have a lot of folks who come and say, oh, I've been smoking marijuana for my glaucoma, and you're steadily going blind. So no, it's not an effective treatment. So my main takeaway today, and it's, this is not enough time. I could sit up here and we could talk about this stuff all day. Diabetes, glaucoma, all this stuff. So I'm just trying to give you an overview. I'm trying to educate you so that you will know how to help take care of yourself. I believe in educating my patients because I will take time and explain to you what's going on with you. So if you detect something, if you see something wrong, you can call me, hey, this is happening, okay? Rather than just say, here, take this and go on. I like my patients to be educated because you can help me take better care of you. All right, does that make sense? Yes, sir. All right. So is my time up?
You're good, but if you're ready for a few questions, we can go, or if you want to continue to present, then that's fine too. We got a few more minutes.
Okay, we can take some questions.
We've got one right here. Hey, listen, let me just give you a little bit of information of how we'll assess and get to your questions. We're going to be crisscrossing the room, so we're going to go from this side to that side and then back again. And so we're going to try and get as many of your questions answered as possible. But of course, we are on a limited time. So we're going to start over here and then we'll go to the center.
Can you tell me how sarcoidosis is manifested in the eyes?
Absolutely. Sarcoidosis is a disease that can affect any organ system in your body. As a matter of fact, I diagnose a lot of folks with sarcoidosis who don't even know they have it till they come to the eye doctor. It's manifested by an iridocyclitis or uveitis in the eye. That means you get inflammation in your eye, and it's a very devastating disease as far as the eye is concerned. It can destroy the eye and blind you. Okay? Yes, sir.
Wait, please wait on a microphone. We are recording this session, so if you're speaking and you're not speaking into a microphone, it's not going to come over on the video when we do it, okay? So wait for a microphone, please, before you ask a question. Go ahead, Julius.
Good afternoon, sir. My name is Dawood Cirillo. I am diabetic type 2. Is it possible for me to make an appointment to come see you?
Oh, yeah, absolutely. I'll give you one of my cards. You can come see me. We'll be glad to see you.
Thank you, sir.
Okay.
Better hurry up, though, because Cornelius is way ahead of me. He's been retired for 2 years, so I'm getting a little tired. So, yeah, I got some here, but he told me this morning that the average lifespan of a physician is 65 years old, and for a black man is 75. So I want to be able to enjoy myself a little bit before I check out.
Okay, we've got one question on this side, and then we'll go back over there.
Does glaucoma, does glaucoma affect peripheral or central vision or both?
Both.
Both.
Thank you.
Got one right here.
How does using electronics affect your eyes? You know, looking at these iPhones and pads and stuff all the time. How does that affect your eyes?
Remember the slide I showed you about the little muscles? Okay, now if I gave you a weight and say, here's a 50-pound weight and I want you to pump it constantly like this, it's just a matter of time before those muscles will get tired. But if you're sitting there focusing on your cell phone or on the computer, you're working the little tiny muscles that's focusing for you, okay? So you get eye strain or what they call astigmatism. But now most of the computer screens now, I think they have filters to prevent that radiation. But there was a study that came out that I think they did, I think it was in South America. I was reading about it not long ago, where they didn't have the protective screens on the computers and they found that it was causing damage to your eye. But just common sense, if you're gonna sit there and stare at a computer for 4 or 5 hours without taking a break, common sense is gonna say, hey, I don't need to do this for 4 or 5 hours. I need to sit back and relax and get away from that. So don't just use common sense about focusing close to a computer screen or anything that you're looking at.
One right here.
Yes, sir.
Dr. Hill, I know you said that you want to see someone who knows what they're doing when it comes to eye exams, but consequently, insurance plays a big part in that. And what about the cost associated with seeing somebody who really knows what they're doing?
Well, you get what you pay for.
I got you after him.
Yeah, but here again, now let me just tell you this. Okay, I had a lady yesterday came into the office. Her co-payment was $40. She said, I don't have $40 to pay Dr. Hill today. He had to see me for nothing because I got to go get my lashes, my nails, and my toes done. And that's going to cost me $275. So I got to pay for that. But I don't want to pay to get my eyes checked.
Priorities.
That's a true story. So,
Okay, we've got one here and then we're gonna go to the center of the room. I think we'll have time for two more after this too. So that we got time for 4 more.
Hello,
so
what are floaters? And if you see black dots, is that considered floaters?
yes, sir. Floaters are clear collagen vascular fibers in the back of your eye that's in the vitreous gel in the back of your eye. Now, the key is if you see floaters and if you see flashing lights inside your eye, or if you see anything like a curtain or veil coming over your vision, then you're in trouble and that's very high risk of you developing a retinal detachment. But a lot of us, majority of us, including myself, I have floaters. I was riding down I-20 and I thought it was a fly in my truck and I was fanning it like this and I said, oh, that's a damn floater. So once you get past 40, it's a natural aging process. We're all gonna get that vitreoresis that occurs that causes floaters, okay? So yes, sir, but the key is if you see like a little light flashing inside your eye, or if you see like a curtain or a veil coming over your eye, then you see somebody right away because that leads to retinal detachment. And you have these collagen fibers that run through the vitreous that attach to the retina. And sometimes when they pull away, they'll put a little hole in the retina and fluids get underneath the retina and peels it off. So it's very important. If you just see little dots or like little strings or little cobwebs without the photopsia, which is the flashing light or the curtains or veil coming over your eye, but either way, you need to get it checked. So if you're having floaters, a recent set of floaters, and see somebody knows what's going on to keep you out of trouble.
Excellent.
Dr. Hill.
Yes, sir.
Should any ophthalmologist be able to give you a proper diagnosis, a proper exam? Do you have any recommendations? Are there some that will be better than others?
Well, now, that's a heck of a question you asked me there. But hopefully any ophthalmologist should be able to do a complete thorough exam on you. Yes, sir.
Okay, and one other thing on the glaucoma, are there symptoms that the average person might be able to recognize so that they would know to go to an ophthalmologist, get treated if they've not been doing it?
Yes, sir.
Good question.
One of the key things is if the pressure is up in your eyes, it will cause a corneal edema. So oncoming lights will appear to be blurry for you. You'll start having loss of side vision as your nerve, you lose your neuron, the vision kind of creeps in. Where you lose your peripheral vision, you come down to that pinhole type of vision. So it's very important, yes, sir, that if you have, here again, the risk factors are this. If you're Black, if you're 30 or older, and if you got a family history, then you need to be seen by somebody who knows what's going on, okay? But it's so slow and such an insidious disease, it can creep up on you and you can lose about 95, 98% of your vision before you have signs and symptoms of it. So that's why it's so imperative that you get yourself checked. Remember, glaucoma is, the rate of glaucoma in the Black community is very high. It's higher than any other ethnicity group that we have. But it's very devastating, it's non-forgiving. So the key is to be proactive rather than reactive.
Excellent. We've got one right here, and then we're gonna go, yes, back to this gentleman. And then I think we'll have time for two more.
Yes, good morning, sir. I'm good. You mentioned about getting your weight to the 25 percentile. Where do you find that information for Black people?
All you have to do is Google the body mass index, and it'll tell you it's based on your height. It'll tell you how much you should weigh for your specific height.
I've looked at some stuff with some of the weights they telling you to be. I'm like, you know, if I get that weight, I look like I'm on crack or something.
Yeah.
But it's better to look like you're on crack and live 10 or 15 years longer than not to.
Yeah. There's also very inexpensive scales that you can buy to monitor your BMI if you're trying to accomplish that 25 percentile. So we got one more.
Let me just say one
Sure.
thing about that. So our dietary habits are horrible. Horrible. And that's what's killing us. Diabetes, high blood pressure, high cholesterol, it's what you eat. Okay. Now, I was vegan for about 14 years, but I started losing all my muscle mass. So I added back a little fish and a little chicken for protein because I was losing all my muscles. But you would do so much better on a plant-based diet. And Cornelius can testify for this, because that joker been skinny ever since I've known him. I don't think he has an ounce of fat on him. Okay, but I know he basically does a plant-based diet. He's a cardiologist, so he knows all this stuff. But when you're eating all this fast food, all this fat and stuff, you're killing yourself. Okay, you do a whole lot better on a plant-based diet. Eat a lot of green leafy vegetables. Stay away from all this fatty food. And any meat that you eat, you might say, oh, this meat is lean. No, it's not. If you were to take a slice of that meat, put it on a slide and look at it on a microscope, all the muscles are surrounded by fat cells. So you're still getting yourself a whole lot of fat.
All right, we got time for one more right here, and then we're gonna do our bingo.
My question concerns injuries that I had. I did high-level sports when I was younger. I've been hit in the eyes several times. And I've been told that the damage from that could have possibly caused the damage from being hit in my eyes when I was playing sports earlier in my life has possibly caused damage. I'm completely blind in my left eye. My right eye is going. I've been told that and glaucoma has probably caused the damage that I'm having right now. Is that possible?
Absolutely. If I had to do it again, I wouldn't play any sports. Because I've had both knees done, both ankles done, both elbows, both shoulders. And so now I'm looking at getting a possible knee implant. So, yeah, anytime you receive any type of injury to any part of your body, you pay for it as you get older. No question about that. And especially as far as your eyes are concerned.
That's one right here.
My brothers and sisters, we've been blessed this morning to have this beautiful angel in front of us. Take heed to what he's saying. He's here for us. He's the master. He studied at Harvard. We are blessed to have this man in our presence. Listen to what he's saying. He got the answers. Don't short yourself. This is the man. Let's give a round of applause.
Thank you so much.
Thank you so much, Dr. Hill. We appreciate you,
Thank you.
and we hope we can come back soon.
Anytime, anytime. Hey. First of all, I'm a little disturbed today. I hope Cornelia, I'm a little disturbed. I walked down the hallway, somebody came in the hallway and said, I go to the gym every day. That's the workout I do in the gym. Yes, sir. I'm leaving. He said, I'm leaving. Walked in and said, hey, hold up. I hope that I'm doing something special for your heart. As men, I go all around the world. The one thing men don't want to do is work out. Only thing they want to say is, I was in the service. I worked all my life. My back hurts, my knee hurt, my shoulder hurt. I had surgery. My pancreas, this. That's all the excuses I hear. Women, they don't care. So I'm saying it was a little disturbing, but I want to say to y'all, I want to applaud y'all for staying and doing something for your temple today. Even every day. And I hope that you learn something special to do in this chair. No more excuses. So let's get ready to go. We're going to pour him out, and then we're going to take off. Let's warm it up now. We got that waistline now. Come on now. I'm taking trouble, sugar. We looking at that back up. I come apart, but that's okay. Trouble man, nothing in the way. Watch now. Come on, we gotta get that waistline. Right there. Watch. Gonna keep moving. Watch. Watch. We gonna stay on that waistline. Give me them shoulders. Oh. Watch this now. Twist it. I know it. Bring it back up. Right. Yeah. You have a water bottle, get it right now. You got a water bottle, let me give somebody a water. You gotta get your water right. Let me get that water right. We're gonna do one hand. Give me that one water bottle. You just need one. Go.
We back.
Let's go.
New song.
Watch my arm.
Give him something to do. Let's go. Give him something to do. Tea time. Go. Give him something to do. 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 Tea time. Give him something to do. Give him something to do. One side at a time. Word bounce. Word jiggle. Word bounce. Word move. Word bounce. Word jiggle. Word bounce. One side at a time. Word bounce. Word jiggle. Word bounce. Word move. Word bounce. Word jiggle. Word bounce. Word move. Jiggle, 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 it's all got. Jiggle, 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 go. Give him something to do. Give him something to do. do. Hey, give him something to do. Rock it, hey. Work, work, jiggle, work, shake, work, jiggle, work, jiggle, jiggle, go. Grind, move, slow, grind, move, slow, slow, Hey, rap! Give him something to do. They ain't gotta hear him. Give him something to do. We came to work today. I need these abs. Slide down in that chair. You get them lower abs. Let's go. It goes down on the run, they gon' blame. Gotta leave with my soul and I came. I know it's gon' leak when I run. But I'm running with life, it's running. Run. Oh. But it's running fame. I did a lot to get here. I put a lot in my ear. Ferrari is back for years. I'm about to take off out with me. I don't want beef with you. My beef with the six will be bro at the end of this hazy. I talked to him daddy. I told him we still coming home. I just hope he don't think I'm just saying. My money keeps coming. Come on! I was talking my rich trying to see what it takes. Now I can charge by the hour, 60 minutes, 7, 10 minutes, that's crazy. My diamonds really be down. Come on! I'm going out and I'm shooting. Rest! Go! Here we go. Y'all looking good. Rest! A lot of people don't know my background. Jamal Lewis is my younger brother. So on the athletic tip, from Cam Newton, Pat-Man Jones, I have the fastest man in the world, Christian Coleman. All these guys I had from 6. I go back to Hines Ward. All those guys in Atlanta that went pro, most of them came through me. All those guys. In the entertainment world, mostly everybody who was originally from Atlanta, from T.I. to Future, when they were little, I trained them up, getting them ready for the stage. And then artist development went away, all the way to Tony Braxton and all of them. So that's my main background. But then when I hurt my back years ago, I went to rehab one time, and I said, that's not enough to get me back where I need to be. So I learned a lot of stuff to do in this chair on my own to save my disc. But I'm in the pool twice a week. If you have any hip problems, shoulder problems, whatever, the pool is saving my life. I don't care if you walk, shuffle, learn something. Get to that pool if you're feeling uncomfortable with your body, any arthritis or anything. It elongates that pool and gravity from walking. I'd rather you go to that pool and walk than get on that track or walk on that treadmill. Treadmills, you have to get on an expensive one because they bounce, boom, boom. So it's jarring your back. And if you don't know how to walk with that heel toe, you have to learn the concept to save your body, your knees. I'd rather you just be at home and just do this. Make sure you're saving your body as you age. So let's get going. Let's get going. I need these hips. We're going to the island. Stay quiet.
I love my life.
Come on.
I love my life.
Come on.
I love my life.
Come on.
and we don't know when tomorrow might bring back the future, the hours away. So I live my life today. So I live my life today. Yeah, so long as I can talk, I want to talk, be I'm tough to say. So I live my life today. So I live my life today. So everybody have to stick it out. I love my life. I love my life. I love my life. So I live my life today. I love my life. I love my life. I love my life. So I live my life today. Make a change, don't make nobody stress up. Don't make no blood pressure, make your life left. Get it. When you hurt a soul and less. Watch it. Happy defend yourself if them try to test you. Thank God for my life. To wake up this morning and alive. Let them go and judge nobody no perfect. Father God alone bring brightness. If you don't like all the sex, go find your love. We not have time to do for the times so hard. Them now man, people now gonna cycle. All go join the morning, join the
Last one. Last one. We up. We up. Let's go. We up. Y'all ain't drum it louder. Belly ring. Let's go. Come on. Find that little step. Clear out your room. Fire. 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 Watch it, watch it. Fire. Stop. Go. 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 Let's go, man. Oh, watch it. Drop. Drop. Bring it back, bring it back. Go. Go.